Hi, Congressman. I'm Polly McKinney. I believe I introduced myself to you one Saturday morning at a Waffle House in Avondale Estates a few months ago. But I'm the Advocacy Director of Voices for Georgia's Children, and we are a policy and advocacy organization. We're not 501c3, but we don't have we don't provide food or medical care or anything like that. But what we do have in our whole child policy agenda, the Georgia Statewide After School Network, which administered a whole bunch of COVID dollars, like $87 million of funding for the After School Boost grants that the state has just re-upped, so we're excited about that. We're about to re-up. And we look at all child policy, like the whole child, so we cover child health, young children, child mental health, child welfare, juvenile justice. We have a nutrition expert who can't be here today. And I know I'm leaving something big out. I don't even know. Well, after school, obviously, but we sort of run the gamut on things. And so for us, looking at the federal activities as a whole are concerning. I mean, Medicaid alone is problematic. Like any cuts to Medicaid are problematic, especially at a time when we were finally feeling like we were on the cusp of getting continuous Medicaid eligibility for kids 0 to 3 or 0 to 6. And then that rhetoric has just flipped upside down. Additionally, cuts to the CDC, public health stuff gives us great heartburn. The vaccination rate in Georgia is always low already, and we have great anxiety around any cuts to public health funding. CDC data collection data is another problem that if we don't, we've already started to lose many of the longitudinal data sets that have given us the information we need to move forward. And so those sort of things aren't necessarily programmatic in a it may not equal a meal. But that information and the lack of funding and resource and institutional knowledge that we need to analyze problems and move forward with all of these things that we're all working on at this table is really concerning. It's going to be really hard to build back. And I know I was supposed to talk about Medicaid, but I think that when we look at the totality of child well-being, from newborns all the way up through young adults, I mean, honestly, I hardly know where to start, but I think that the loss of the data and the way to track our failures and our successes is something that the United States has been exceptionally good at doing for a very long time, and it is, in my opinion, key to our success. And I don't know that any of us can really do our work with the most efficiency or the most well-informed advocacy without it.